So, both breathing and mindfulness influence the nervous system from the inside by changing patterns of attention and respiration. There's also another pathway into the nervous system that involves something called the vagus nerve. The vagus nerve is one of the major communication channels between the brain and the body. It connects the brain to many organs, including the heart, lungs, and digestive system. And it plays a key role in regulating emotional states and physiological balance. Researchers have found that stronger vagal activity, something often called higher vagal tone, is associated with better emotional regulation and lower levels of inflammation. One of the interesting things about the vagus nerve is that it runs down through the neck alongside the carotid arteries before continuing into the chest and abdomen. Because of that pathway, certain gentle movements of the neck and shoulders can influence signals traveling along that nerve. When the muscles in the neck and upper shoulders relax, it can send feedback to the brain that the body is safe enough to shift toward a more regulated state. So, a very simple way to encourage that shift is through slow, gentle movements of the head and neck. Let's try a small exercise together. If you experience any pain at all during this exercise, please stop and consult your healthcare provider before going any further. Allow your shoulders to relax and drop slightly. If it feels comfortable, let your hands rest loosely in your lap. Now slowly tilt your head just slightly to one side. There's no need to stretch deeply. This is more of a soft release than a stretch. As your head tilts, take a slow breath in. And then as you breathe out, allow the muscles on that side of the neck to soften. You may notice a gentle sensation of lengthening along the side of the neck. Stay there for a moment and take another slow breath. Now, slowly bring your head back to the center and pause here for a breath. And then gently tilt the head to the other side. Again, there's no need to push or stretch. Just allow gravity to do the work. Take a slow inhale and then let the breath leave the body slowly as the neck softens. Notice whether the shoulders release a little more as the breath leaves. Stay here for another breath. And then slowly bring the head back to the center again. And take one more slow breath in. And let the breath leave the body naturally. Sometimes even small movements like this can create subtle shifts in the nervous system. The muscles around the neck and shoulders begin to release tension. Breathing becomes a little easier, and the body moves slightly further away from the stress response. Practices like this may seem simple, but they can be surprisingly effective when repeated regularly. Before we close, I want to say a word about safety with these kinds of practices. Vagal stimulation through gentle movement is generally very safe when it's done slowly and comfortably. But there are still a few important guidelines to keep in mind. First, keep the movement small and gentle. You don't need to stretch deeply or push into discomfort. If you feel pain, pulling, or straining in your neck or shoulders, that's a sign to ease off or to stop. These practices are meant to be soft signals of safety to the body, not workouts or intense stretches. Second, pay attention to how you feel as you practice. If you notice dizziness, lightheadedness, nausea, or a feeling that you might faint, pause immediately and bring your head back to a neutral position. Take a few natural breaths, and if needed, stop the exercise altogether. Your system may be more sensitive, and that's important information to respect. And third, if you have a history of significant neck issues, heart rhythm problems, frequent fainting, or other serious medical conditions, it's a good idea to check with your healthcare provider before experimenting with new vagal practices, even the gentle ones. You can also let any physical therapist, chiropractor, or medical provider you're working with know that you're interested in vagal support so that they can help you find approaches that are appropriate for your body. The goal here is to never push through, but to collaborate with your nervous system. When you approach these practices with respect, gentleness, and curiosity, they're much more likely to support regulation and healing in a sustainable way. Thank you for listening.